Most people believe that heart disease begins with a dramatic moment, a crushing pain in the chest, a desperate call for help, an ambulance rushing through the night. But as a cardiologist, I can tell you that the real danger usually begins much earlier, hours before those symptoms ever appear. In many cases, the damage starts with simple evening habits that seem completely harmless. Habits repeated night after night, year after year, gradually increasing blood pressure, disrupting your metabolism, stressing your heart, and making your arteries more vulnerable while you're asleep. The surprising part is that these habits don't feel dangerous. They feel normal. Eating a late dinner because you were busy, watching television until midnight, having one extra drink to relax, skipping a short evening walk because you're tired. None of these decisions seem important on their own, but your heart notices every one of them. While you sleep, your heart doesn't stop working. In fact, nighttime is one of the most important periods for cardiovascular recovery. Your blood pressure should naturally fall. Your heart rate should slow down. Blood vessels relax, inflammation decreases, and your body begins repairing tiny injuries that happen throughout the day. Think of it as your body's overnight maintenance program. When everything works properly, you wake up with a heart that's recovered and ready for another day. But if certain habits interfere with that recovery, your heart never gets the rest it needs. Instead of repairing itself, it spends the entire night dealing with unnecessary stress. Over months and years, that extra workload can quietly contribute to high blood pressure, diabetes, irregular heart rhythms, artery damage, and eventually heart attacks or strokes. That's why cardiologists don't only care about what happens during the day, we also pay close attention to what happens before bedtime. Tonight, I'm going to show you 7 bedtime mistakes that research has linked to poorer heart health in older adults. More importantly, I'll explain exactly why they matter and the simple changes that can help your heart recover the way nature intended. Some of these habits may surprise you. Let's begin with one that millions of people do every single evening without realizing the stress it places on their cardiovascular system. Imagine finishing a large dinner at 9 o'clock at night. Maybe it's rice, fried chicken, creamy pasta, dessert, and a sugary drink. You're full, sleepy, and within 30 minutes you're lying in bed. It feels comfortable, but inside your body, your heart has just started working overtime. Digestion is one of the most energy-demanding processes your body performs. After a large meal, blood flow shifts toward your stomach and intestines to help digest and absorb nutrients. To keep enough blood reaching your brain, kidneys, muscles, and every other organ, your heart has to pump harder. Heart rate often increases. Blood pressure may stay elevated longer than it normally would. Blood sugar rises, insulin levels increase. Triglycerides begin climbing in the bloodstream. Instead of entering a calm recovery mode, your cardiovascular system stays active long after you've turned off the lights. For healthy younger adults, the body usually adapts without difficulty. But as we age, our arteries become less flexible. Blood vessels don't relax as easily. The heart has to work harder to achieve the same result. That's why late heavy meals become much more significant after the age of 60. Several studies have shown that eating close to bedtime is associated with poorer blood sugar control, higher nighttime blood pressure, acid reflux, and reduced sleep quality. Each of those factors places additional strain on the heart. The solution isn't to skip dinner. It's simply to give your body enough time. Whenever possible, try finishing your main meal at least 3 hours before going to bed. Choose moderate portions. Include vegetables, lean protein, healthy fats, and fiber. If you become hungry later in the evening, keep it light. A small serving of plain yogurt, a handful of nuts, or a piece of fruit is usually a better choice than another full meal. This small adjustment allows digestion to settle before sleep begins. Your heart gets the quiet environment it has been waiting for, and that's exactly what it needs. Now let's move to another bedtime habit that's even more common. Many people spend the last hour of the evening sitting perfectly still, watching television, scrolling through social media, reading news on a tablet. By bedtime, They may not have moved for 2 or even 3 hours. It seems relaxing, but your circulation tells a different story. Many people think that simply sitting down in the evening helps the body recover after a long day. Rest is important, but remaining completely inactive for several hours before bed can quietly affect your circulation in ways most people never notice. When you sit for long periods, the large muscles in your legs stop contracting. Those muscles normally act like a second pump, helping move blood back toward the heart. Without that assistance, circulation slows. Blood can pool in the lower legs, and your heart has to work a little harder to keep everything moving efficiently. Researchers have found that prolonged sitting is associated with higher blood pressure, poorer blood sugar control, and increased inflammation, even in people who exercise earlier in the day. In other words, a morning walk doesn't completely erase the effects of sitting motionless for the rest of the evening. This becomes especially important after 60 because blood vessels naturally become less elastic with age. The lining of the arteries, called the endothelium, doesn't respond as quickly as it once did. Good circulation depends on regular movement. The good news is that you don't need an intense workout before bed. In fact, vigorous exercise too close to bedtime can actually make it harder to fall asleep because it raises adrenaline, heart rate, and body temperature. Instead, think gentle movement. A relaxed 10 to 15-minute walk after dinner can improve circulation, help muscles absorb glucose from the bloodstream, reduce the blood sugar spike that follows a meal, and encourage your blood pressure to begin its normal nighttime decline. Even walking around the house while talking on the phone, stretching for a few minutes, or doing light household chores is better than remaining seated for hours. Some studies have even shown that short bouts of light movement after meals improve insulin sensitivity, which is important because insulin resistance and heart disease often develop together. Your heart doesn't expect perfection. It simply responds to small habits repeated consistently. One short walk every evening may seem insignificant, but over months and years, it becomes one of the simplest investments you can make in your cardiovascular health. Now, let's talk about something many people use specifically to help themselves sleep. A glass of wine, a small whiskey, perhaps a beer while watching television. Alcohol has long been thought of as a nighttime relaxant. Many people say it helps them fall asleep faster, and in the beginning, that may be true. Alcohol can make you feel drowsy because it slows activity in certain parts of the brain. But falling asleep quickly and getting restorative sleep are two completely different things. As the night progresses, alcohol begins disrupting the deeper stages of sleep that your brain and heart depend on for recovery. Your heart rate often stays higher than normal. The nervous system becomes more active during the second half of the night. Sleep becomes fragmented, even if you don't remember waking up. Many people who drink alcohol before bed wake up feeling tired, despite spending 8 hours in bed. From a cardiovascular perspective, the effects can be even more concerning. Alcohol may temporarily lower blood pressure, but several hours later, it often causes a rebound increase. It can also trigger irregular heart rhythms in susceptible individuals. Cardiologists sometimes refer to this phenomenon as holiday heart syndrome, where even moderate alcohol intake can provoke episodes of atrial fibrillation in people without previous heart disease. Over time, frequent evening drinking has been linked to higher blood pressure, poorer sleep quality, weight gain, and increased cardiovascular risk. If you enjoy alcohol, it doesn't necessarily mean you must eliminate it forever. The timing and amount matter. Avoid drinking shortly before bed whenever possible. If you choose to drink, have it earlier in the evening, consume it in moderation, and drink water alongside it. Many people are surprised to discover that after just a few alcohol-free evenings, they begin sleeping more deeply, wake up feeling more refreshed, and notice lower resting heart rates on their fitness trackers. Sometimes the healthiest habit isn't adding something new, it's removing one small obstacle that's preventing your body from recovering naturally. The next bedtime mistake may be the most overlooked of all because almost nobody can feel it happening. It's silent. It develops gradually, and millions of people have it without ever knowing. I'm talking about sleep apnea. Sleep apnea is one of the most underdiagnosed health conditions in adults over 60. Millions of people have it, yet many assume their loud snoring is simply an annoying habit rather than a medical condition. I've met countless patients who laughed about their snoring for years, only to discover it was placing enormous strain on their heart every single night. Here's what actually happens. While you're asleep, the muscles in the back of your throat relax. In some people, especially those who are overweight, have a larger neck, or naturally narrower airways, those relaxed muscles temporarily block the flow of air for 10 seconds, sometimes even a full minute. During those moments, oxygen levels begin to fall. Your brain immediately recognizes something is wrong. It sounds an alarm. Stress hormones like adrenaline are released. Your blood pressure suddenly rises. Your heart rate jumps. Then your brain briefly wakes you just enough to start breathing again. Most people never remember these tiny awakenings, but they can happen 30, 50, even 100 times during a single night. Imagine someone repeatedly pressing the accelerator and brake on your heart while you're trying to sleep. That's essentially what untreated sleep apnea does. Instead of getting 8 hours of recovery, your cardiovascular system spends the entire night responding to repeated emergencies. Over months and years, this repeated stress begins damaging blood vessels. Blood pressure becomes harder to control. Inflammation increases. The heart muscle gradually thickens because it's working against higher pressures night after night. Research has consistently linked untreated sleep apnea with hypertension, atrial fibrillation, stroke, coronary artery disease, and heart failure. In fact, many people first discover they have sleep apnea only after experiencing a cardiovascular event. The warning signs are often surprisingly subtle. Yes, loud snoring is one clue, but it's far from the only one. Do you wake with a dry mouth? Morning headaches? Do you feel exhausted even after spending 8 hours in bed? Has your partner ever told you that you stop breathing or suddenly gasp for air during sleep? Do you frequently wake up needing to urinate several times every night? Many people assume these are simply normal parts of aging. They are not. They may be your body's way of asking for help. Fortunately, sleep apnea is highly treatable. A sleep study can often diagnose the condition in a single night. For many patients, treatment with a CPAP device keeps the airway open continuously while they sleep. I know many people hesitate because they worry the machine will be uncomfortable, but almost every patient who sticks with treatment tells me the same thing. I wish I had started years earlier. They wake up with more energy. Their blood pressure improves. Their daytime fatigue decreases. Many even notice improvements in memory and concentration because their brain is finally receiving adequate oxygen throughout the night. If someone has ever complained about your snoring, don't ignore it. If you frequently wake up exhausted despite spending enough hours in bed, bring it up with your physician. One conversation could identify a condition that has been quietly affecting your heart for years. Now let's move to another bedtime habit that seems harmless but can quietly increase cardiovascular risk. It's something almost everyone does, and it begins with a small glowing screen in your hand, your smartphone, or perhaps your tablet, or even the television across the room. Most people think these devices only affect their sleep. The truth is, they may also be affecting their heart. Most of us reach for our phones without even thinking about it. We answer a few messages, scroll through the news, watch a couple of short videos, or check social media one last time before closing our eyes. It feels like a harmless way to unwind after a busy day. Unfortunately, your brain doesn't see it that way. The bright light from phones, tablets, and televisions, especially the blue wavelengths, signals your brain that it's still daytime. That delays the release of melatonin, the hormone that tells your body it's time to sleep. Without enough melatonin, falling asleep becomes more difficult. Even if you do fall asleep quickly, the quality of that sleep often suffers. Instead of spending long periods in deep, restorative sleep, you experience more light sleep and more frequent awakenings throughout the night. Why does this matter for your heart? Because deep sleep is when your cardiovascular system performs much of its overnight maintenance. Blood pressure naturally falls, heart rate slows, stress hormone levels decline, inflammation begins to decrease. Your blood vessels have an opportunity to relax after supporting you all day. But when sleep is shortened or repeatedly interrupted, those protective processes become less effective. Over time, poor sleep has been linked to higher blood pressure, obesity, insulin resistance, type 2 diabetes, and an increased risk of heart attack and stroke. Several large studies have shown that adults who consistently sleep fewer than 7 hours each night have significantly higher rates of cardiovascular disease compared with those who regularly achieve 7 to 8 hours of quality sleep. The problem isn't only how long you sleep, it's how well you sleep. A person who spends 8 restless hours tossing and turning may receive far less cardiovascular benefit than someone who enjoys 7 hours of uninterrupted deep sleep. One of the easiest ways to improve sleep quality costs absolutely nothing. Create a technology-free period during the last 30 to 60 minutes before bed. Instead of scrolling through your phone, try reading a printed book. Listen to calming music. Practice gentle stretching. Spend a few quiet minutes talking with your spouse or family. Some people enjoy simple breathing exercises or gratitude journaling to help their minds slow down before sleep. These quiet activities allow melatonin levels to rise naturally. Your nervous system shifts away from stress and into recovery mode. Your heart notices the difference. Now let's discuss another habit that surprises many of my patients because they believe they're actually protecting themselves. Many older adults intentionally avoid drinking water in the evening because they don't want to wake up during the night to use the bathroom. On the surface, that seems perfectly logical. Nobody enjoys interrupted sleep, but avoiding fluids for several hours before bedtime can sometimes create another problem: dehydration. As we get older, our sense of thirst becomes less reliable. Many people simply don't realize they're mildly dehydrated. When the body doesn't have enough water, blood becomes slightly more concentrated. Your heart must work a little harder to circulate it efficiently. Even mild dehydration can increase heart rate and make it more difficult for the body to regulate blood pressure. If someone already has coronary artery disease or heart failure, dehydration may place additional stress on an already vulnerable cardiovascular system. That doesn't mean you should drink several large glasses of water immediately before lying down. Instead, aim for good hydration throughout the day. If your physician hasn't advised fluid restriction because of kidney disease or heart failure, a modest glass of water during the evening is generally reasonable for many healthy adults. The goal is balance, not dehydration, not overhydration. Just giving your body what it needs to maintain healthy circulation while you sleep. One final bedtime habit may seem surprisingly simple, yet research continues to show that it can influence sleep quality, blood pressure, and overall cardiovascular health. It has nothing to do with food, nothing to do with medication, nothing to do with exercise. It has to do with the temperature of the room where you sleep. Now let's bring everything together, because none of these habits work in isolation. They work because they protect your heart during the hours when it is most vulnerable. The good news is that you don't need an expensive supplement, a complicated diet, or an intense exercise program before bed. You simply need a better evening routine. Here's the routine I recommend to many of my patients. Finish your main dinner about 3 hours before bedtime, whenever possible. Choose a meal that includes lean protein, vegetables, healthy fats, and moderate portions instead of an oversized late-night feast. After dinner, avoid spending the entire evening sitting motionless. Even a gentle 10 to 15-minute walk around your neighborhood or inside your home can help improve blood sugar, digestion, and circulation before sleep. If you take medication for blood pressure or heart disease, take it exactly as your physician has prescribed. If you're unsure whether morning or evening dosing is best for you, don't guess. Ask your doctor during your next appointment because medication timing should always be individualized. If you or your partner notice loud snoring, choking during sleep, or excessive daytime fatigue, don't ignore it. Request an evaluation for sleep apnea. One sleep study could identify a problem for years, has been silently stressing your heart for years. Keep yourself comfortably hydrated during the evening. You don't need excessive amounts of water, but you also shouldn't deliberately avoid fluids out of fear of waking during the night unless your physician has specifically advised fluid restriction because of heart failure or kidney disease. About an hour before bed, dim the lights and step away from phones, tablets, and televisions. Your brain produces melatonin naturally when darkness arrives, helping lower stress hormones and prepare your cardiovascular system for restorative sleep. Set your bedroom temperature somewhere between 65 and 69 degrees Fahrenheit, or about 18 to 20 degrees Celsius. This range allows your body temperature to fall naturally, promoting deeper sleep while reducing unnecessary strain on your cardiovascular system. Most importantly, don't ignore symptoms. If you experience chest discomfort, unexplained shortness of breath, unusual sweating, nausea, sudden weakness, dizziness, or pain spreading into your jaw, shoulder, arm, or upper back, especially if these symptoms occur at night, seek emergency medical care immediately. Heart attacks don't always look like they do in movies, particularly in older adults, women, and people with diabetes. One thing I've learned after years of caring for heart patients is this: heart disease rarely develops overnight. It develops from thousands of small decisions repeated day after day. The encouraging news is that protection works exactly the same way. One healthier dinner, one evening walk, one properly managed medication schedule, one better night's sleep, one doctor's appointment that leads to diagnosing sleep apnea before it causes permanent damage. These small choices accumulate into stronger arteries, healthier blood pressure, better circulation, and a lower risk of heart attack or stroke. Remember, your heart never takes the night off. It continues beating more than 30,000 times while you sleep, supplying oxygen and nutrients to every organ in your body without asking for recognition or reward. The least we can do is create the conditions that allow it to perform that job safely. If you found this video helpful, share it with someone over 60 who may benefit from these simple evening habits. Sometimes one conversation, one shared video, or one small lifestyle change can make a life-changing difference. Thank you for watching. Take good care of yourself, and I'll see you in the next video.